Hello and welcome to the Queen Elizabeth Patient Podcast. We're here today in the Proto building and I'm pleased to introduce Dr. Peter Blackburn. He is an NHS consultant, a clinical psychologist who has worked in oncology and palliative care services for the last 10 years. He's also experience of working in chronic pain and chronic fatigue trauma and has an interest and passion with regards to looking at acceptance, mindfulness and compassion. We've done some previous podcasts relating to uncertainty and dealing with cancer in this way. One of the things we've mentioned during the previous podcasts is how meditation can be extremely important when dealing with uncertainty. And Peter's going to share his knowledge with regards to this. So Peter, thank you and welcome for coming today.
Thank you for inviting me. It's a very popular thing is meditation right now. There's a lot of good research to support it. And the kind of meditation or type of meditation we're going to talk about today is mindfulness meditation, which is probably the most known one currently. And there's many definitions for mindfulness meditation. The one that is probably the most popular is John Kabat-Zinn's definition, which is about paying attention very purposefully, so choosing to pay attention to something very much in the here and now. And then the tricky bit, which is non-judgmentally, so not judging what you're experiencing. And our minds are constantly assessing, constantly evaluating, constantly judging. And some of this is really useful, but other times it might not be useful because we reach negative conclusions that are maybe not that helpful. And therefore being able to step off that judgmental mind and just be with whatever it is can be hugely helpful. And this is what we found with people who've got chronic pain or depression. So it helps with a lot of physical health problems. It also helps with a lot of mental health problems. I think personally for me, it helps me stay balanced. And I think when I've got a busy day, then an extra meditation at about lunchtime of just checking in where I am helps me refocus. I become more productive as a consequence.
I think the profile of meditation is getting bigger and bigger. And like you say, a lot of the research is very positive. What would your advice be? Because I know if I mentioned this to some patients, they might say it seems a bit out there for them. It's not for me. I maybe haven't got the time to invest in that. What am I going to get out of it? What would you say to that?
I think there's probably some investigating the benefits of it, which are around well-being, reduced blood pressure being one of them. I think that when people can understand that it doesn't need to be very long. When I say very long, maybe you start at 3 minutes a session and build it up and up and up. And interestingly, in the US Marines, they have their version of it.
I've heard about this one.
They call it attentional control technique, which is, more manly, I don't know. But, big business has taken it on, the likes of Google, Yahoo, see it as a way of helping people be more balanced but also more productive. The Houses of Parliament, MPs are learning to meditate. Brownies have a badge for it.
Children actually being brought up with the notion of meditation.
Just think in this busy world where children are bombarded by lots of information, lots of potential stress, to be able to find peace in the present moment is a really good thing to offer children.
I think at the minute as well, for patients recovering from cancer or going through cancer, like I say, once upon a time before smartphones and technology, you could switch off to a lot of it once you were in your household. Whereas now we've got our telephone in front of us, we're constantly being beeped for WhatsApp or Instagram, Facebook. It's all there. There's breaking news. It's constantly. Do you feel that brains can just kind of be overcharged with all this information?
I think that's definitely the case. And I'll own up, there's periods in my life where I think I get out of balance and there's that overstimulation of just either seeking information or there's just so much going on, and to be able to stop that and focus on just being without judgment is a really helpful thing to do. And if you think about the process of learning mindfulness meditation, people think it's about breathing, but it's not about breathing. It's about using the breath as an anchor to the present moment, because when we're paying attention to our breathing, we're focusing on something that's happening right now. So a good way of learning mindfulness meditation is first to spend maybe a few weeks, a few months just paying attention to your breathing, and noticing what that's like. What will happen is probably quite quickly your mind will drift away, it'll wander somewhere. Notice where it's gone to and bring it back to focusing on the breath. Not long later, your mind will wander again. Notice it and bring it back. And this is the process of learning meditation or mindfulness. It is being able to focus on something, then recognize your attention has wandered, and then to gently bring it back. Not curse yourself, not telling yourself you're rubbish at this, just gently, kindly refocusing your attention. And as we talked about in the previous podcast, there are many apps that people can use. We talked about Headspace being probably one of the most widely used. And once again, we have no shares in this. We've used it and benefited from it. But also we know many people else who have used it too. But there are a lot more apps that can offer this present moment awareness. And then there are on YouTube lots of videos and online classes that you can join.
And I think as well as one of the popular things with like yoga and Pilates, it kind of incorporates that as well. I think there's been a lot of research about how using this meditation with yoga has seen some fantastic responses with the immune system and overall sort of well-being.
Yeah, and I think it's probably because we're activating our parasympathetic nervous system, which is about rest and repair. And if you think about, conversation just a few minutes ago, in this overstimulated world, well, we'll be in our sympathetic nervous system, all about getting stuff done, responding to stuff. And what we need to do is to turn on the parasympathetic nervous system, which for a lot of people only occurs when they're asleep. But we need more time in the parasympathetic nervous system. One way of doing it is yoga. Another way is meditation. So there's something about being as the process of meditating, but it's also a doing thing. It's a skill that needs practice. Attention is like a muscle of the mind. It needs daily workouts if it's going to get bigger and stronger. So it's deciding, yes, this is for me, and I'm going to practice it come what may. Just as you put value on brushing your teeth every day, well, let's make meditation that same level. And the more we practice, the more we'll develop this healthy habit. And some days we'll think we're really good at it and we'll really enjoy it. Other days we'll dread it, we'll be bored about it. Those are really the days when we'll learn more from it, actually. So regardless of what your mind's telling you about, I don't want to do it, can't be bothered, let's do it. Because there's learning to be done and there's benefits from doing it.
Is there any sort of best time to do it?
Well, probably when you're not going to go to fall asleep. That's the big one, because meditation is about falling awake in the present moment. And if often people close their eyes because that helps with the concentration. Close their eyes, that maybe activates that parasympathetic nervous system that then starts to lead towards sleep. If you're starting to feel a bit slumpy and a bit sleepy, open your eyes, get some light into that brain, wake it up, and then close your eyes again and refocus on whatever you're meant to be focusing on.
Is it best to do it, can you do it on the move? Do you have to be in a room on your own? Does it have to be dark? What kind of environment would you say?
I think those are good questions. First thing is, can you do it on the move? You can do mindful walking. Remember, you're paying attention to one thing at a time. So if you can mindfully place one foot in front of the other, choosing to do that, then mindful walking is going to work. I don't know how you do mindful running, because choosing to do one foot at a time rapidly, I don't know if that would work. So there's something about, right, I'm choosing to do this. It's very purposeful. You can do it with other people. It could be mindful walking together, but then you won't be talking. You will be walking. And we always encourage people never to do it whilst driving, because the purpose of driving is to drive, not to meditate. You can't do two things at once. So lots of practice. Start small, make achievements, a bit like with your exercise. Set yourself goals that you can achieve and give you that sense of achievement, that buzz, and then start stepping up the length of the meditation, and then start to explore different types of meditations. One's called the body scan, which is learning to take your breath to different parts of the body and breathing into those parts of the body. And then as time goes by, you can then start to pay attention to difficult experiences like pain and being able to pay attention to it without judging it. And this can be really powerful. Likewise, you can start to pay attention to your mind, what's going through your mind, and see your thoughts as products of a mind rather than them being absolutely true and you've got to go with them and getting stuck in the flow of them. Maybe you step back and just watch the flow of your mind.
Because I think it's all kind of caught up with training for how we look, how much we can maybe do press-ups, or how far we can walk, or how far we can run. And I think probably one of the biggest things that we miss out is that the brain is a muscle, and like you say, it's training it and committing to it as well.
Yeah, and a physio friend would say that the neurons that fire together wire together, and what he meant by that is that when you repeat an action, it becomes a neural network, it becomes a new habit. So the more we do something, the more it will become our default action.
And how quickly, if we were to practice this, how long would you take before you would maybe sort of see the benefits of that?
I think that's a good question. And it depends what the focus is on. Some people will feel like almost immediate benefits. Others, it takes time, maybe a few weeks. There's a pain study that looked at people with back pain, scanned them, got them filling questionnaires, and kind of just got a picture of their pain and how severe, how intense it was. They taught them a meditation that I think that lasted about 20 minutes. These people practiced it for 4 days, and then the next day they scanned them, redid the questionnaires. And what they found was that there was, for some, a small reduction in the sort of physical aspect of the pain. Maybe some had a big reduction. But in terms of the emotional part of pain, there was big reductions. So that the people were seeing pain, right, okay, there's this physical bit of it, but the moment that I stop judging it as good or bad, actually it lessens. It's less intense. And that was just after 4 days. And you've caught me on the hop because I probably should be able to quote you some data about blood pressure as well, but I can't. I feel like getting on Google, but I'm not going to. I'm going to just sit with the uncertainty.
It's like mastermind.
I know. I'm going to sit with the uncertainty of not knowing.
Oh, well, thank you so much, Peter, for sharing your insight into meditation. Like I've said before, I think, we have this vision of what we think meditation is, but I think it's given a lot more clarity today. So thank you for doing that.
Well, thank you for inviting me. I think there's something definitely, as I said before, around understanding the theory behind something, but it's the practice where we actually do the learning.
And what we'll do is what you'll find in one of the neighbouring podcasts is about actually practicing meditating, and Peter is going to talk you through that, and it's a very useful podcast. So please feel free to listen to this as well. But thank you very much, Peter.